that the one by Walmart?
Nope, it's the one right here next to the surgery center. So this big building here is the surgery center.
Ah.
The gray one next to it is Wasilla Family Medicine. And then that brown one behind that is our specialties clinic.
Okay.
Yeah. So family medicine, they have about 7 providers. Not all of them work full-time. Most of them work 4 days a week. And then we have one that works 3 days a week and one that works like part-time.
Okay.
And then it's all family medicine, so pretty simple there. The specialty clinics is a little bit more, can be challenging depending on, just because it has different specialties in it, and so the receptionists check in and check out for the different specialties. So they're checking in, checking out for general surgery,
Okay.
ENT, and then dermatology. Dermatology is a lot faster paced. They see a lot more patients because their visit appointments tend to be very, focused
Mm-hmm.
on a small thing, and so they see a lot of patients a day. I know Dr. DeRuis likes to see at least 50 patients a day when he's in clinic, so that one's definitely a more high pace, high volume clinic. Mondays is kind of a slower day though over there that gives everyone time to catch up on their admin time, because dermatology typically only sees clinic Tuesday through Friday, so Mondays are a little quieter for you guys over there, so it gives you at least a day a week to kind of,
Okay.
get your bearings and get everything caught up. A lot of what our receptionists are doing is obviously, greeting people when they come into the clinic, getting them to the appropriate person. They're there for an appointment, checking them in, and then when they're done with their appointment, checking them out. So they're collecting any necessary paperwork that we need, getting copies of IDs, insurance cards, checking eligibility through our system, collecting any necessary co-pays, co-insurances, deductibles, etc. If they have past due balance, seeing if they can collect on that, or maybe
Payment
getting
plans.
them set up for a payment plan, or in contact with our billing department to work out some sort of, maybe filling out, debt forgiveness or something like that. They're also, if a provider's sick, they help them get patients rescheduled, scheduling follow-ups. Since the family medicine, you won't see as many referrals in that department, but not incoming anyways, but for the specialty clinics, we see a lot of referrals.
Okay.
We do have a referral coordinator, Alize, but obviously, the front desk, you kind of work hand in hand with everyone when you're at the front desk, I feel like. But they also work hand in hand with her, because she's calling out a lot of times on the referrals, but sometimes they're calling back, and, they can go ahead and get them scheduled and everything like that. And then we have Ashley for the specialty clinics, who does our checking on authorizations for the VA, TRICARE, and stuff like that. So she'll work hand in hand with you guys as well, making sure we get those for their appointments. And then new patient we went over. We have there's what you call appointment ticklers in Athena. So if a provider sees a patient, they want to see them back. A lot of times we try to schedule them when they're checking out, but every now and then, patient doesn't want to yet, or so forth. So the front desk is working those, calling them to get them in when they come across those, and then also working wait list, if someone needs to get worked in, or they want to be seen sooner. We also use that to kind of fill holes in the schedule if people drop off, kind of last minute, or, within a day or two. And I think that answering phones obviously is a big part of reception. So a lot of it's customer service based, things that you're probably used to or experienced with. Capstone M&A does offer health benefits that you can opt in or opt out of, so healthcare, medical, dental, vision. 401k after you've been here for 6 months, and then PTO starts at 15 days a year, and then as you're here longer, it accrues at a higher rate. And then the first 90 days is typically a probationary period. So that first 90 days, if there's any unpaid leave, any leave or anything like that, it's unpaid until you're through that probationary period. With that being said, do you have